The latest news, updates, and more from the world of health and medicine. This is Medical Minutes.
First, congratulations.
Thank you.
What does this feel like to, I mean, you've published in other respects before, but to go through this process and here you are now on basically a tour.
Well, this is a experience that's unlike any other I've been through, as you mentioned. I've written journal articles and academic books, and I wanted this to be something very different. One of the challenges of being Surgeon General and of the pandemic was that we were trying to communicate scientific information to the lay public. And so in this book, I didn't want it to be wonky. I didn't want it to be something that only a PhD or an MD could get through. I wanted it to be something that was fun in some places, and I tell stories about interactions with Axl Rose and Oprah Winfrey, but I also wanted to give people practical advice. And so from that standpoint, I felt really good about where we ended up.
And this is something that we all lived through. We all have our own memories and experiences and how the pandemic affected our individual lives. So then you could bring that from, a policy making standpoint as well, but also for my neighbor to read and understand and basically relate to.
Well, one of the things I talk about is that I went through the pandemic from multiple perspectives. I, of course, was Surgeon General of the United States, but I was also a practicing physician at the same time. I was working at Walter Reed Medical Center. So I understood what it was like for our healthcare workers to have to deal with this novel virus. I was a husband of a wife who has stage 4 cancer. So I understood the dynamics of wanting to keep your loved ones safe in any uncertain situation, but also the challenges of delayed health care. I was the first Surgeon General in modern times to have school-age kids, 3 teenagers. So the dynamic between your kids doing virtual school versus wanting to keep your kids and your family safe was something I could appreciate. And I try to bring out all those things in the book so that people understand that in many cases we oversimplified these complex discussions. We made them into either or, but there are always trade-offs. And I think that's important in the future, that we look to those trade-offs and we try to understand the perspectives of other people who aren't bad. They just may see the problem differently than what we do.
At what point did you, at least in your mind, start writing this book? Was there a lightning strike moment when you thought, this is living history that I need to document from my perspective?
Well, that's a great question, too. And it's interesting. This book is coming out 3 years almost after I've left office. And it's hard to really talk about war when you're still in the midst of it. And so I wanted to give it time. I needed to give myself time to really think back and reflect. And I had hoped that we would be post-pandemic and post a lot of the politics that made the response incredibly difficult. Unfortunately, in many ways, we're not. And I was almost forced into writing this book because I saw that we kept having surges. We kept having the same mistakes repeated over and over again. And that's really the central theme throughout the book, is that we changed the captain of the ship, but we keep charting the same course over and over again. And if we don't actually reflect on what the root causes are, we're not going to be able to do better in the future.
More than 3 years after COVID arrived in the U.S., you believe the federal government still is not acting fast enough to protect Americans from COVID. So what is it doing wrong? How are we going to right that ship?
Well, let me give you some context. In October of 2020, at a presidential debate, Joe Biden pointed out that we had over 200,000 COVID deaths. And he said anyone who is responsible for this many deaths should not continue to serve as president. 200,000 deaths. Well, you look at 2021. Joe Biden was president for an entire year. We had 460,000 deaths. You look at 2022, there were still over 200,000 deaths. And that's despite having vaccines, having ample personal protective equipment, despite having tests available. And so the point isn't to say that Joe Biden was wrong. The point is to say that, again, we keep making the same mistakes over and over. We don't have a good enough data collection system so that we can understand where the problems are occurring. We have terrible communication from the federal government in both administrations. And I talk about the challenges during our administration, but we see those mistakes repeated over and over again. We're continuing to see vaccine hesitancy. For instance, we have less than 1 in 5 people who are up to date on their vaccinations, and that's killing us. And we aren't focusing on baseline health status. So that's one real key I point out in this book. The idea that the U.S. did worse than other countries, particularly in 2020 on transmission, is a myth. We actually had about the same transmission rates as most places in Europe. We did terribly, though, in terms of deaths. So once you got sick, more people were likely to die if you were an American or in the United States. And that is because we have higher rates of obesity. We have higher rates of high blood pressure. We have higher rates of diabetes. And if we continue to fail to pay attention to those baseline health issues, we're going to continue to see the same terrible results no matter which disease we're presented with.
Through the book, we get to know more about you and the background leading up to before Washington. You recall your senses of joining the climate in Washington and feeling that surely everyone in the White House, in your words, would genuinely care about making our country great for everyone. Would you consider yourself a stubborn optimist?
I am a stubborn optimist because I've lived all over the country and all over the world. And what that's allowed me to understand is that whether you're in Dallas, Texas, or whether you're in Boston, Massachusetts, people just want to do right by their families and by their communities. They see it, again, through different lenses, and they therefore support different policies. But people, I think, want to do the right thing. And the book really focuses on how politics has divided us, and how people leverage politics and leverage social media to point out our differences, when the truth is we share more in common than what there ever could be to separate us. And if we focus on the commonalities, then I actually think we will come together. But we're in a point right now leading into another election where we're focusing on those differences. And it's going to tear us apart, and it's going to prevent us from ever being able to see the true enemy, in this case, a virus, a once-in-a-century virus, because we keep thinking the enemy is each other.
Is there room for a stubborn optimist in Washington now that you've been through it?
Well, it's fascinating. So the Washington Post did a story on me when I was Surgeon General, and the title of the story was, "He may be the nicest guy in Washington, but is that what we need right now?" And I will tell you that you can get by in the short term by focusing on differences. But when you look at long term, I really think it's important that you try to work with people, even if you don't always agree with them. And I learned that here in Indiana. I learned that with the Scott County HIV outbreak that occurred in a community that was rural, mostly white, not at all the traditional risk factors for an HIV outbreak, and certainly not a community where a lot of the politics are aligned with someone who's African American, who grew up on the East Coast. But by going down there, by spending time with the folks in that community, by getting to know them in church and over meals, we realized we had a lot in common. And we were able to work together to legalize syringe service programs, a very controversial intervention in the state at the time, and in some cases still, by again, working together. And so I remain optimistic. But I think we have to look into ourselves, look internally, and not point fingers at other people and say, what are the biases that I have that are preventing me from being able to reach across the aisle, whatever that aisle may be, whether it's political or racial or geographic.
Do you detail how COVID redirected your career from your original passion projects, one being the opioid crisis when you first entered the administration? Outside the obvious toll on lives and society, do you resent the pandemic?
You know, we have had over 1 million people die of COVID in this country. And there's just no other way to look at it other than a terrible, terrible tragedy. However, we know that some of the biggest changes in a positive direction in health in this country have come during times of war and crisis. it really pushes us to do things that we previously were unwilling to. So for instance, we had a 7,000% increase in telehealth during the pandemic. Telehealth isn't new. We've been talking about it for 30 years, but the pandemic pushed us off the fence, and now many more people have the ability to access health care because of that change that occurred during the pandemic. The pandemic has forced us to reckon with the fact that certain communities don't have the same opportunities to be healthy. And I talk about that in the book. It's one thing to say, go home and isolate. But if you don't understand that someone is living in multi-generational housing and sharing a bathroom with 10 other people, you don't understand that isolation means nothing to them, and that they're going to quickly infect everyone throughout the house. And we saw that over and over again in marginalized communities and communities of color. And so I really feel like we have an opportunity to honor those million lives lost. And I say honor them because we can use them to save exponentially more lives in the future if we reflect on the lessons that the pandemic taught us. And that's really what the book is about. It's about saying, how do we use this moment, which is a moment we're going to remember for the rest of our lives, as an opportunity instead of just looking at it as a tragedy?
That's positive steps forward as a nation. What about you as a doctor, as a husband, a father, on the personal level, the pandemic's toll on you?
Well, I admit I have PTSD, and I mean that very honestly. It was very jarring for me to be in a situation where I was trying to be the nation's doctor, but everything that I said and did was framed through the lens of politics. So I'll tell you a really quick story about someone from Indiana, Axl Rose. He and I famously got into a Twitter argument that went viral during the pandemic because I was asked to condemn folks who were going to a Trump rally. And what I said was very much what I would say as a physician. People need to understand their own personal risk. They need to understand their situational risk, and then they need to take appropriate action. And I literally talk about that in the book, PSA, in terms of personal health advice that I give to individuals. I said, but it's not my job to tell people they shouldn't go to a Trump rally any more than it's my job to tell them they shouldn't go to a George Floyd rally, because the virus doesn't care where you're going to or why you're going. And Axl Rose called me a POS, and I'll let folks look that up since we're on air because we can't use the verbiage that that he used towards me for saying that. But again, I want people to understand that the virus doesn't care, and so it was very hard for me to get caught up in the politics of the time, and to have my words viewed through whether or not they felt I was supporting Biden or Trump instead of whether or not I was giving sound health advice.
Are you in any way thankful for the pandemic? Not that it happened, but that if it were going to happen, no matter, that you had that place at the table that you mentioned so often in the book? Well,
that's another interesting question. And so I come from a military family. I believe in service. I come from a religious family. I believe that no one in the Bible actually wanted to be where God put them, from Moses to Noah to Jesus himself. And so I believe I was there for a reason. And I can't tell you how many times I was the only at the table, the only parent, the only person of color, the only person who grew up below the poverty line, the only person whose brother was currently incarcerated as my brother was during the pandemic. And so I think God put me there for a reason, and that reason was to be a voice for many of those marginalized individuals. So from that standpoint, if the pandemic was going to occur one way or the other, I'm thankful that I was there. But just like many people in the Bible, I paid a heavy cost in terms of my reputation, in terms of my own personal health. Dr. Fauci and I would regularly get 2 to 4 hours of sleep a night for a year straight because we were just constantly working around the clock. And then you put in that work, and the very people you're trying to help are often the ones who are attacking you, again, because of how they perceive your political positioning to be. That was hard. It was tough. But if I had to do it over again, I would do it over again, because if you're not at the table, you're on the menu. And it's incredibly important that you are there representing the people and the causes that you care about.
At any point during President Trump's public comments, including using bleach as treatment, did you consider resigning as Surgeon General?
Well, I will tell you that the best advice I got from a mentor was to have your resignation letter filled out on day one. And so literally every day when you're in these high-profile jobs, you have to ask yourself, am I accomplishing more by being at the table than what I could by leaving? And what I'll say very honestly to you is that President Trump was impeached twice. There were many attempts to remove him from office. So whether you love him or you hate him, I think it's foolhardy to think that me not being at the table would have impacted whether or not he continued to serve in his role, which is what many people are really saying when they say, should you have left? You contrast that with the fact that, again, had I left, there wouldn't have been that voice at the table of a father of school-age kids, of an African American, again, of someone who grew up poor. And from my standpoint, every time I did that assessment, I came to the same conclusion, and that conclusion was that it's more important for me to be here than it is for me to leave. And I still believe that to this day in my heart, that I was able to accomplish a lot of good. And that good isn't always focused on, but we were able to secure rent protections for people during the pandemic, for instance. I worked with the faith community and with Black and brown communities to help promote testing and to help provide personal protective equipment for individuals. I actually was involved with Operation Warp Speed and helped increase the number of Black and brown individuals involved in the vaccine trials so that people could have confidence when the vaccine came out that it was not only effective, but that it was safe and that it had been tested in their communities. These are things that I don't feel would have happened had I not stayed at the table. So the answer is yes, I thought about it frequently, as you do in these jobs, and I kept coming back to the conclusion that my being there was far too important for me to leave.
Certainly many pride points, but that sounds like an overwhelmingly emotional tug and pull constantly with the sense of responsibility that you had to represent.
Absolutely. It really was, and not just on me, but on my wife, as I mentioned, who was dealing with stage 4 cancer at the time. And for my kids who had to go to school in Washington, D.C., which is a very political city. Their classmates knew who I was, and they had strong feelings one way or the other about the person who I was working for. So there was certainly an emotional toll on all of us. But again, that's why they call it service. If it was easy, everyone would do it. And I really do believe that I was there for a reason, and I was able to accomplish a lot of good despite what many people perceive as a tough situation.
You served with Donald Trump during the COVID pandemic. Do you believe he is fit for another 4 years in the Oval Office? Well,
that's a great question, too. And one of the things I say to folks is that I was the United States Surgeon General, which is the nation's doctor. I am a doctor, and that's primarily how I identify. And when a patient comes into my office, they don't ask me, does Donald Trump think I should get a pap smear? Does Donald Trump think I should get that colonoscopy today? And so what I would say is it's not my job as a physician or even a surgeon general to opine on whether or not someone else should vote for a particular person. It's my job to say, okay, here's the situation we're in. How do we make the best of it? And I want to relate it back to the Scott County HIV outbreak. We had people who were choosing to inject drugs. It wasn't my job to say, that's a terrible decision you're making. It was my job to say, here's the risk of what you're doing. Here's how we mitigate that risk. And here's how we get you through the other side as safely as possible. So I would say whether or not someone supports Donald Trump or Joe Biden or another candidate out there, I'm going to work my best to take the decision that they make and get them to the most positive outcome they can. And I do that by serving, and I do that by trying to steer clear of politics, and I do that by showing up.
Are we putting the country at risk in leadership of Donald Trump in the Oval Office, of Joe Biden serving another term?
Well, again, that's a great question. And I do think, and I talk about this in the book, that regardless of whether people are Democrats or Republicans, Biden fans or Trump fans, that we need to demand more out of our leadership. We need to demand that they focus on health inequities. We need to demand that they create environments where it's easier to eat healthy, where it's easier to exercise, where people aren't hesitant to get vaccinated. We need people who are going to support health, because that's the underpinning of our economy. And that's something that COVID showed us. Showed us that if we keep making the same health mistakes, our economy is going to be shut down over and over again, as we see during these surges. And whether or not you believe we should shut down from a governmental perspective, there's no doubt that every time we have a surge, restaurants are unable to staff. Schools end up being shut down because teachers can't show up, or your kid isn't learning because there's a substitute teacher. And so if we don't prioritize health and healthy communities, then it doesn't matter who's in the White House. That's really the point of the book. We were sold this idea in 2020 that if only we changed who was the captain of the ship, that, again, we would see drastically different outcomes. Not only did we not see different outcomes, we saw far worse outcomes in terms of deaths. So it tells you that simply focusing on who's at 1600 Pennsylvania isn't what's going to prevent the next pandemic. It's really trying to focus on the root causes.
You say you would do it again, given the invitation. The book wraps up with one short sentence: we can and must do better. What's the first step in that?
Well, I would say the first step is looking internally and saying, what can we each do as individuals to create a better environment? There are things individually we can do to better protect ourselves against COVID, but there are also things that we can do as individuals to support our baseline health and to support healthier communities. But the most important lesson throughout the book is that we really need to check our biases, our own personal biases. We need to understand when our biases about politics, about parties, about individuals are getting in the way of our ability to have some of these difficult health conversations that we need to have to move forward. On a societal level, I would say that, and I talk about this in the book, there's so many things that we could do that aren't impositions on our personal freedoms to better prepare us for the next pandemic. Ventilation. Improving ventilation is something that we all could definitely do to help improve our response to the next pandemic, making it easier for people to access vaccinations. So not everyone who's unvaccinated is vaccine hesitant or vaccine resistant or anti-vax, as they put it. In many cases, they just don't have the ability to easily get vaccinated because maybe they're a single parent and they're worried about getting sick after they get the vaccine. Or maybe they can only get a vaccine at a pharmacy during regular business hours and they're working 2 or 3 jobs. There's lots that we can do moving forward. And I think that instead of focusing on the negative, if we focus on the things we can positively do as individuals and as communities and as governments, then I think we'll be better positioned to prevent or at least to mitigate the next pandemic.
So as an individual, was this therapeutic?
It was therapy. It was therapy because there's so much that happened in 2020 that we don't even think about now. The fact that we didn't know whether it was safe to bring our groceries in. Should we leave them outside for several hours? Did we wipe them down before we bring them in? The fact that we were at a point where we literally didn't have personal protective equipment, and I did a video advising people how to make masks out of T-shirts. That's not something I wanted to do, but when you're in war, you use what you have. And so it was therapeutic to think back through how far we've come. And I think if we can focus on where we were and how far we've come. We have an amazing vaccine. We have personal protective equipment. We have testing. We have tools that we didn't have in 2020 when we were scared to death. And we leverage those tools to protect ourselves now and in the future, including improving our baseline health and creating healthier communities, then we'll be in a better place. And to me, that's not just therapy, that's actually ultimately the remedy for us all.
That's perfect for me. Is there anything that I haven't asked you that you'd want to address?
No, I don't. Well, I mean, other than where to get the book.
Yes. Where can we get this book?
Well,
Amazon, everywhere.
The book is available now on Amazon, on Target.com, on Barnes & Noble. And so I advise folks to get a copy. The most ringing endorsement I can give to you for this book is that my wife hates all my scientific writing. And she read through it and she said, it's actually pretty good. So I told her I should put that on the inside cover. Lacey Adams says this book is actually pretty good. But again, a lot of fun stories. I talk about Oprah Winfrey. I talk about conversations I've had with Colin Powell and Axl Rose and Chef Jose Andres. Again, folks who were big names, but who were also just struggling to get through a difficult time as we were. So I hope folks will read it. I hope folks will enjoy it. But most of all, I hope folks will take the lessons that I try to communicate in this book to create better health for themselves and for our nation.
This is the Medical Minutes Podcast.